Good afternoon, and welcome to the Champaign Go Red for Women digital experience. My name is Brianna Collins, and I'm the evening anchor at WCCU TV here in Champaign, and I'm excited to be your MC for today's event. And thank you so much for being here today to support the life-saving work of the American Heart Association. Cardiovascular disease is the leading cause of death for women, taking one woman's life every 80 seconds. That's more than all forms of cancer combined. And while nearly 80% of cardiac events can be prevented, 1 in 3 women are living with heart disease and stroke. That's a third of our mothers, our sisters, and our friends. It's time to demand better when it comes to women's heart health outcomes. We have to join together and take a stand for our own health and inspire the women who we love to do the same. Our hope is that you leave this event ready to be an agent of change for women, to be a relentless force for longer, healthier lives for the women in your life. Each individual voice strengthens our efforts because, as you know, as women, together, there's nothing we can't achieve. Throughout this afternoon, you can donate to support the American Heart Association's life-saving mission. On your screen now, and really throughout our entire program, you'll see a prompt where you can donate. Please be generous. Every dollar we donate means more family members, more neighbors, and more friends who have the opportunity for a healthier future. Thank you so much to our leading sponsors today, Carl and Health Alliance, Christie Clinic, University of Illinois, and Sarah BMW of Champaign. We have a fantastic program for you today, so let's get started. Please welcome the chair of the 2021 Champaign Go Red campaign, Dr. Wanda Ward, Executive Association Chancellor for Administrative and University Relations at University of Illinois.
The University of Illinois Urbana-Champaign is proud to align alongside the mission of the American Heart Association and the Go Red for Women movement. 1 in 3 women lose the battle to heart disease, and we can help change that. AHA has a mission to be a relentless force to reduce the devastating impact that heart disease and stroke have on patients and their families. While the event looks a lot different this year, one thing remains, and that is the life-saving impact of the mission. We all know someone who's been touched by heart disease or stroke. My life was touched by the impact of heart disease many years ago. We lost my maternal grandmother, the matriarch of our family, to heart disease suddenly. This happened just 3 months prior to a major milestone in my own life, a significant graduation. While it was many years ago, the loss is still felt, and yet our commitment to American Heart Association is even stronger. I'm honored to serve the American Heart Association as the Go Red for Women chair, and you'll see the list of leaders who journeyed alongside me in this effort. AHA helps us bring science to life every day and well beyond the walls of the fine hospitals throughout our community through treatment and protocols that save lives. The University of Illinois Urbana-Champaign is thankful to be a recipient of AHA research grants, namely 14 different studies totaling approximately $1.9 million over the past 5 years alone. That averages about $373,000 per year in local investment right here in Champaign. Receiving these grants speaks to the research talents of the work we do here on campus and our partnership with the American Heart Association. Throughout my leadership journey, I've heard many personal stories throughout the community from those who shared how their loved ones were directly touched by the mission's advancement in science, hospital protocols, legislative victories to protect the patient, CPR training, and more. These stories translate into our commitments to the mission as you will see listed and celebrated during the program. Sustainability of local support is key, and we will celebrate that today during the See You Next Year portion of the program, which will highlight the 2022 supporters of the mission in their commitment to be with us next year as well. Over the last year, we've seen the impact AHA has had on COVID-19 and the work AHA is doing around challenges like long hauler post-virus, which will be so important for many who suffer from long-term impact from the virus. On behalf of our dynamic leadership team who worked on this year's campaign, we thank those joining us in the effort to support the American Heart Association mission as we're all making a difference in the lives of so many. Embrace and enjoy the program, and please share generously today as we plan to raise critically needed funding for a mission that has touched each of us in some way.
Thank you so much, Dr. Ward. We're grateful for your leadership and your commitment to this year's campaign. And now we're excited to share today's medical moment brought to you by Christie Clinic.
Hi, I'm Dr. Joanne Archie, a family medicine physician at Christie Clinic. Heart disease is the #1 killer of women, causing 1 in 3 deaths each year. The disparities of heart disease in underserved populations is real and requires our attention and action. We all deserve access to quality health care, and that is what drives me to do what I do. I became a doctor to provide care in areas where medical providers were needed. I want my patients to know that they are people first and patients second. I strive to educate my patients concerning their health and partner with them to provide the best care possible. By continuing our efforts to provide research, education, and healthcare access to the underserved and underrepresented populations, we will help to close the gap on these inequities and help ensure better health for everyone.
Hi, my name is Darby Poff, and I'm a nurse practitioner with Christie Clinic Department of Cardiology. Few too many women know about the risks of their #1 killer, cardiovascular disease. Every day I work with my patients to educate them on the risk factors affecting their heart health. All women need to have regular screenings for diabetes, cholesterol, and have their blood pressure and weight measured. If your provider finds your cardiovascular health is at risk, they may recommend some lifestyle changes or medication. I challenge you to a heart-healthy lifestyle commitment and to start improving your cardiovascular health. Living a heart-healthy lifestyle means eating a healthy diet, limiting alcohol, staying at a healthy weight, not smoking, and getting daily exercise. Encourage other women to join you. Let's take each other's health to heart.
Hello, I am Dr. Sabrina Kahn-Jones, and I am an internal medicine physician with Christie Clinic. I've always been interested in connecting with people. To me, healthcare, and in particular primary care, is an excellent way to get to know people. Establishing and maintaining a relationship with my patients and individualizing their care can make a meaningful and lasting impact in their lives. One of the most important things an individual can do for their overall health is to establish with a primary care provider. This relationship allows us, as medical providers, to advocate for and educate our patients on their journey to a healthier lifestyle. As primary care providers, our work does not end at a diagnosis of cardiovascular disease. That's when our partnership with our patients strengthens. The power of medicine comes from collaborating with other healthcare providers to ensure our patients receive the best and most comprehensive care.
Thank you so much for sharing your expertise. We all know how important a nutritious diet is to our heart health. So Christie Clinic is back to share some tips on how to incorporate more healthy foods into our diets.
Hi, I'm Laura Jacob, registered dietitian at Christie Clinic, and I'm here today to share some ideas to make your diet heart healthier. One of the best ways to start making your diet heart healthier is to read the nutrition facts labels. And so for a heart healthy diet, there's 3 things I encourage people to look at: fiber, sodium, and saturated fat. all of the information on the label is important, but those for heart health are the three big ones. So diets higher in fiber are known for being heart healthy, and diets lower in saturated fat and sodium are also known for being heart healthy. This particular food is a high fiber food. So this is 100% whole wheat bread. It's good to look for whole grains. So the way that you know if something is a whole grain is either it says 100% whole wheat on the front of the package, or if you're not sure, because some things are called wheat but may be honey wheat, or they may actually be made with an enriched flour. In order to tell if it's a whole grain, the first ingredient in the ingredient list, so you read your ingredient list and it should say whole grain something or 100% whole grain. And so that's the one way to tell for sure. If it says enriched flour, then that's a refined grain and they've removed the fiber and the germ, and what's left over is much less nutritious and less heart healthy. So for fiber, it's good to look at the daily value, percent daily value. So anything with 10% or more of the daily value is going to be a good source of fiber. So look at that daily value column. Sodium is another good thing to look at, the daily value column. So when we choose a low sodium food, anything with 5% or less of the daily value of sodium would be considered a low sodium food. So that's a really good way. Comparing labels, maybe everything's not 5% or less, but you can compare two labels and say, ooh, this one is better. So some good options for choosing seasoning for lower sodium is garlic powder, onion powder, black pepper, white pepper. White pepper is really zingy, which is good. I also like lemon. So this is a dried lemon, and it's just dried lemon, and it's in powdered form, and you can sprinkle it on things. Gives it kind of a nice zingy flavor when you're reducing sodium. So sometimes low sodium diets can seem kind of bland. So until your taste buds get adjusted to that, you probably want to really jazz things up, or you could continue jazzing things up once you get adjusted to it too. Lemon is good, or even fresh lemon or lemon zest is really nice for flavoring your food without the salt. I get asked about sea salt often. Is sea salt a better choice than regular salt? So if you look at the labels, again, the label is your best piece of information. 1/4 teaspoon of regular salt and 1/4 teaspoon of sea salt both have 590 milligrams of sodium, which is 25% of the daily value of sodium. So the same volume is the same amount of sodium. The one benefit that you may find from sea salt is that you get a little bit more salty flavor with less salt. So that's still salt. You're still adding salt to your food, but maybe you can use a little bit less for the same kind of level of saltiness. All of the other ones too, all the specialty salts like pink Himalayan, and all of those are salt. So all have the same amount per gram of sodium. Some other ways to reduce the sodium in your diet would be to choose reduced sodium or no added salt or low sodium labeled vegetables, canned products. Most canned vegetables, green beans, corn, peas, tomatoes, diced tomatoes, tomato sauce, you can get a no added salt variety. So that's a really good, convenient option and then you control the sodium in that particular food. Beans they're more available now. So beans are a really heart healthy food for a lot of reasons, but the canned variety sometimes is high in salt. I actually was able to find a low sodium variety of these chickpeas, and this is a reduced sodium variety of another type of bean, a cannellini bean. So those are available. They're becoming more available in the stores. If you can't find a low sodium or reduced sodium product, you can rinse off the beans, and that reduces the sodium by about 40%. So that helps as well. Or if you really want to cook, you can use dry beans or dry lentils, and they have no sodium essentially. So those are some good options. And beans and lentils are a really good source of heart healthy fiber. Canned soup is one thing that tends to be really salty. This particular food in one serving has 870 milligrams of sodium, which is 38% of the daily value. One of the things that people use cream soups for often is casseroles or things that obviously you want a creamy ingredient. So you could replace cream soup with evaporated skimmed milk. Evaporated milk has a kind of a creamier mouth feel, so it's kind of a good substitute for soup in a recipe. It's a little bit thinner, so you may need to use less or add a little bit of thickener to it. But the evaporated skim milk is 2 tablespoons, 25 calories. A half a cup of the soup is 100 calories. And it only has 35 milligrams of sodium in the evaporated skim milk, which is 2% of the daily value. And 2 grams of protein and 0 grams of saturated fat, as compared to the saturated fat in the soup, which is 1 gram, which is 5%, which is actually low saturated fat, but still it's less. So another thing that's important to remember in a heart-healthy diet is to follow a low saturated fat diet. Saturated fat is the type of fat that clogs the arteries and promotes inflammation. Diets higher in saturated fat are associated with heart disease. So some things to think about for saturated fat is any fat that is solid at room temperature, like coconut oil or butter, are high in saturated fat. That saturated fat is what makes it solid at room temperature. So those should be limited. Coconut oil is not actually a heart-healthy fat, although it was kind of a fad for a while, but not great for the arteries. There's a lot of controversy about tub margarine. I personally like to use tub margarine. So the difference between tub margarine and stick margarine is made with trans fats. So that partially hydrogenated vegetable oil is what makes stick margarine solid at room temperature. And trans fats are also very bad. So stick margarine and solid shortening are full of trans fats, good thing to avoid. So as a spread, I like to use soft tub margarine. It's much lower in saturated fat. So this particular product, as compared to butter. So butter has, in 1 tablespoon, has 100 calories and 7 grams of saturated fat. This particular product in 1 tablespoon has 60 calories and 2 grams of saturated fat. So there's still some saturated fat there, but it's a lot less than butter. And it's really easy to spread on your toast. So other foods that tend to be high in saturated fat would be meats and fried foods and baked goods and things like that. So it's important to kind of look at the content there. One way you can reduce the saturated fat in your diet as far as your protein choices goes is to choose leaner proteins, such as chicken without the skin, that's a big one, fish that's not fried. One of the places where people get a lot of saturated fat is from sausage and those type of products. So you can actually make your own sausage. And then I'll be sharing a recipe with you for that. So you would just buy lean ground turkey or lean fresh ground pork and make your own. It's actually really tasty, and then you don't have the MSG and the nitrates and all the salt that's in there as well. So that's a lot lower in saturated fat than the packaged, pre-packaged sausage. So some ingredients that go into that would be like sage and black pepper and several other herbs and spices, and then you would just mix it up and make it into patties and cook it, and that's actually really good, and you could make quite a few ahead of time and freeze them for later use. And taco meat can be high in saturated fat and sodium, so if you're using the packet of taco seasoning, that's really salty. But you can make your own. Just use the very lean ground beef, like 95% or leaner ground beef, and also kind of drain it and rinse it with hot water, and that takes even more fat off of it. And then there's a variety of herbs and spices, and you would just cook it up, add the herbs and spices, and cook it together, and that makes a much healthier taco seasoning. Another way to reduce your saturated fat, condiments. Condiments are a big source of saturated fat in people's diets. Ranch dressing, that's a big one. People eat a lot of ranch dressing, so packaged dressings are high in saturated fat and sodium. So one really flavorful way to decrease your calories, your sodium, and your saturated fat from creamy dressings is to use olive oil and some type of flavorful vinegar. So I really like balsamic vinegar. It has a lot of flavor, and I don't miss the salt. And olive oil is a heart-healthy fat. So there's all kinds of fun flavors of vinegar available, so just check it out and just kind of shake it up in maybe a mason jar or a mixer jar and put it in your salad, and it's much healthier. Using reduced fat or light sour cream is about half the fat and calories of the regular variety of sour cream, so there's one way to reduce saturated fat there. Cream cheese. Cream cheese is delicious. I love cream cheese, but it is high in saturated fat if you use the standard variety. So this particular standard cream cheese has 6 grams of saturated fat in 1 ounce or 2 tablespoons. That's 30% of the daily value. I really like these little wedges, these light cream cheese wedges. They come in a little single serving size, which is nice so you don't overdo it. And they have only 30 calories in 1 wedge, and it's actually plenty, and 1 gram of saturated fat, which is 5% of the daily value. So that's low in saturated fat, so that's a really nice option as well. Another way to reduce your consumption of ranch dressing or dip, a healthier option would be to dip your veggies in hummus. And so you've got chickpeas, which is a nice heart-healthy protein, high in fiber, and oftentimes is made with olive oil, which is a heart-healthy fat. I actually make my own. It's not really very difficult. And so I dip those veggies in there. You get more veggies, and you get more heart-healthy ingredients in your diet. Eating more fish meals is a great way to reduce your saturated fat. But now deep fried fish is not a great way to reduce your saturated fat. But you can make your own, and you can make it really tasty. So you might just get plain fish and fresh, and you could do some lemon juice or some of that lemon sprinkles, which is kind of handy, so you don't always have to buy a lemon. Lemon zest works nice as well, so that gives it a lot of flavor. Black pepper, and maybe you do a little breadcrumb to make it seem crispy, make it a little bit crispy, and a spray of olive oil, and bake that in the oven, and it'll be really tasty and very heart healthy. Beef, we tend to eat a lot of beef. Beef can be very high in saturated fat. To reduce your saturated fat from beef, choose loin, round, tenderloin, and sirloin, and cut off that visible fat, so that reduces it quite a bit. So those would be the leaner varieties. Sometimes take a little bit moister, longer cooking to get tender, but it's definitely worthwhile to limit your saturated fat there. One thing you might do, think about mushrooms or beans as a way of kind of decreasing the beef in a recipe. So, for example, a beef stew. You could make a beef stew with loin or tenderloin, cut off the visible fat, dice it up, but you could even reduce your usual beef ingredients in it by chopping up some mushrooms, dicing up some mushrooms. So very heart healthy and no fat there, no sodium, and they have a nice meaty texture. And they taste good in beef stew. So that's one way to actually reduce your meat intake. You could also include beans again as well. A few more ideas to make your diet a little heart healthier. For your baked potato, instead of butter and sour cream, it's really tasty idea is to have salsa and a little dollop of light sour cream. So it's about half the fat and calories and much lower in saturated fat than regular sour cream, and then you don't have all of the butter, which is really high in saturated fat. So that's actually really tasty. For lunch, a lot of times people bring a bag of chips, which is pretty salty and high in fat. So some alternatives to those chips at lunch might be just to bring an apple, nice and crunchy like chips, but a lot heart healthier. Or another idea is jicama sticks. I really like them. It's just it's a root vegetable, nice and crispy, and you can just peel it and slice the whole thing up into little matchstick sizes. And it's really good with some lemon juice and zest, or some of the crystallized lemon, maybe some pepper, but it's kind of a nice alternative side dish. So thank you for joining me for these heart-healthy food ideas.
Thank you, Christie Clinic. Now our friends from Carl are here with today's Heart Health Spotlight.
It's very important to stay in contact with your provider, especially during a pandemic. Cardiovascular disease remains the #1 killer of both women and men in this country, and 1 out of every 4 patients will die from heart disease. So it's very important to stay informed of things that are going on with the pandemic and to inform your provider of any new symptoms or medication questions or refills that you may need during this. You can't just stop and not continue to take care of your cardiovascular disease or risks. If you're afraid of coming into the hospital or coming into the office, that's understandable, but be assured that the hospital is taking precautions. We're doing temperature checks at the entrances. Masks are mandatory. There's visitor limitations. So we are doing all the precautions necessary to help keep our patients and their loved ones safe. If your heart is already compromised and you with underlying heart disease, then you're at a major disadvantage if you happen to contact the COVID-19 virus. Therefore, it's very important that you continue to take your heart medications, continue to stay in contact with your provider so we can help keep you heart healthy and prevent you from contacting the virus or preventing you from being hospitalized because of the virus. COVID-19 long haulers are those patients that had COVID-19 maybe weeks or several months ago, and now they are continuing to have persistent symptoms of pulmonary or cardiac symptoms. Many of them are, finding themselves back in the hospital for treatment, for symptom treatment. They are not necessarily contagious at this time, but they still are recovering from the initial virus. Some of the symptoms are shortness of breath, maybe cardiac arrhythmias, elevated heart rate. They're having symptoms of lung compromise or a symptom of a cardiac problem. And so they are often getting readmitted back to the hospital. And at Carle, we're still here exploring and researching ways to best treat these patients. So everyone, including heart patients, should continue to do the common practices of hand washing, wearing a mask, avoiding large gatherings, especially indoors, and social distancing. Patients with heart disease are at a greater risk of contracting the COVID-19 virus, and if they do contract it, they're at a greater risk of having worsening complications. So I would strongly recommend that everyone, but especially heart patients, get the vaccination. And the American Heart Association is recommending that all heart patients are vaccinated, especially because the risk of having COVID-19 outweighs the risk of having any complications from the vaccine itself. It's very important for patients to stay in contact with their primary care provider because there are many things that we can do at the primary care level to help prevent patients from developing cardiovascular disease, or at least help to decrease the risk. Patients with high blood pressure, diabetes, high cholesterol, and smoking all have a higher risk of developing cardiovascular disease. So if you stay in contact with your primary doctor, they can help treat these medical issues and help prevent future cardiovascular problems. It's no surprise that what we eat may impact our cardiac health. Cutting back on sweets and sugars and staying away from processed food, and we can maintain the well-balanced diet with whole grains, lean proteins such as chicken and fish, fruits, vegetables, and healthy fats. So it's really important to maintain a physically active lifestyle. If you're inactive, it increases your risk of cardiovascular disease and other health complications. 30 minutes of moderate activity 4 to 5 times a week is what's recommended. That could be walking, jogging, biking, gardening, taking hikes, walking your dog. It's always important to at least contact your provider if you have questions, and then the office or the provider can help direct you to where to go, if it would need to be to come back into the office to be seen, or go to the convenient care or to the emergency department. Carl has been offering telehealth or virtual visits since the beginning of the pandemic, and we still are offering those. They're very nice once the provider has a virtual visit with the patient. If there's anything that they're expressing that is concerning or alarming, we can schedule that for the patient to come in, perhaps the same day or within the week, to come in and be seen by a provider. By maintaining a healthy lifestyle, you're supporting your heart health and supporting your overall well-being.
Thank you, Carl, for your generous support of the Go Red for Women campaign here in Champaign. Now I'd like to introduce our next speaker, Dr. Alex Stemmer, Medical Director of Advanced Care Medical Specialists. Dr. Stemmer co-chaired the COVID-19 task force for the Symphony Care Network, which has 12 locations in Illinois. He collaborated with the National Institute of Health and Eli Lilly on a study that resulted in FDA approval for the first effective drug to treat early COVID-19. Please welcome Dr. Stemmer.
I'm Dr. Alexander Stemmer. I'm a board-certified infectious disease specialist with a long-standing interest in the care of the advanced elderly.
Hello, everybody. My name is Tanisha McSpadden. I'm a registered nurse.
Symphony has asked me to be the medical director of several of their facilities, and when the COVID pandemic began, I was asked to co-chair the COVID-19 task force to develop protective procedures for both our staff and our patients. With the current availability of vaccine, we have one more opportunity to take a giant step forward. So I'm here today to try to address some of the most important questions that I have been frequently asked during the lead up to the introduction of the vaccine. One of the questions I'm asked most frequently is if I will be accepting the vaccine. And the answer is unequivocally yes. I look forward to the opportunity to get the vaccine, not only to spare myself the risk of contracting the disease, but to spare my patients the risk of contracting the disease from me. At the same time, I will be protecting my family, which is an equally important goal. By the time you're seeing this interview, I will have taken the vaccine.
I myself have been asked most frequently, am I going to be receiving a vaccine? And my answer is yes. Being a COVID-19 survivor just lets me know how important it is not to be able to transmit the disease to the residents, to my family, to my friends, and my coworkers. So Dr. Stemmer, the vaccines were developed in a lightning speed. How safe and effective could it be?
While the vaccines have been developed extremely rapidly, we should remember that both Pfizer and Moderna have been working on this technology for about 10 years. The mRNA vaccine technology was developed for both the SARS and MERS epidemics that came much earlier in this century. The federal government has been extremely efficient in making sure that none of the barriers and obstacles that can occur in the testing and approval process delayed the introduction of the vaccine. But no corners have been cut. There have been a large number of people tested, all of their side effects have been documented, and the efficacy of the vaccine has been found to be much higher than expected. We have to recall that our patient population is the population most at risk and represents a disproportionate number of the deaths that occur every day. By our accepting this vaccine and moving forward with it, we protect ourselves, we protect our patients, we protect our coworkers, and we protect our families. I think it's a vital decision and an extremely important opportunity for all of us who are in healthcare.
Would this be a yearly vaccine like the flu?
That is a frequently asked question, and the simple answer is we don't yet know. The coronavirus is a large virus and it does mutate. However, we don't know if these mutations will involve the spike protein, which is the portion of the virus that the vaccine is active against. So only time will tell. At this point, it's too soon to have an answer for your question.
Will the vaccine have any long-term side effects? And also, what are the side effects?
That is an extremely important question, which almost everyone asks. At this point, 40,000 people have received the vaccine, and there are no neurologic side effects. There are some side effects which are common. It is common after the vaccine is administered to get pain at the injection site and to get some muscle aches. And it is very common to have fatigue the day after the vaccine, but these symptoms are very short duration. And I should emphasize that the symptoms of the disease are far, far worse than any of the side effects of the vaccine. And protecting ourselves from contracting the disease and having those symptoms is a very important decision on our part.
Is this a live virus?
No. There is no live virus. There is no dead virus. There are no parts of virus that are injected into the person receiving the vaccine. The vaccine consists of a substance called messenger RNA. It's a normal part of the human body. It is manufactured, and the messenger RNA, which is injected, teaches our body to make the spike protein. Our immune system then senses the spike protein and reacts to it, making antibodies to protect us from getting infected. So there is no part of any virus that is going into our body with this vaccine.
Dr. Stemmer, as frontline healthcare workers, is it true that we're being used to experiment to verify the efficacy of the vaccination?
I understand your concerns. And I think the simple and best answer is no, we are not being used in an experiment. We are being given the opportunity to interrupt the catastrophe of this pandemic. Remember that in the skilled nursing environment, COVID-19 has typically been brought in by a healthcare worker who does not know that he or she is ill and have unintentionally transmitted it to patients who then further transmit it to other healthcare workers. As healthcare workers currently, we're being given the privilege to get to the front of the line, to receive this vaccine to protect ourselves, to protect our families, and protect our patients, and to interrupt the process that has caused so many thousands of deaths in skilled nursing facilities. So this is an opportunity and not an experiment.
Do you think the approval of the vaccine was inappropriately accelerated for political reasons?
That's an extremely important question, which many people have asked, and I've considered carefully. I believe that the simple answer is no. Remember, the federal government had nothing to do with the development or the testing of this vaccine. What the federal government did do is financially support the pharmaceutical companies so they could speed up the trial to enroll a large number of patients and properly evaluate the efficacy and safety of the vaccine. And that has all been carefully documented. The federal government also made sure that obstacles in the approval process did not unnecessarily delay the release of the vaccine. Recall that the presidents of 9 pharmaceutical companies pledged in writing not to release any vaccine until all of the efficacy and safety studies were completed and met all of the highest standards. They have lived up to that commitment. The speed of the vaccine is largely due to the fact that Pfizer and Moderna had both been working with this technology because of previous coronavirus epidemics, SARS and MERS, and so the technology was available, and they then got the financial support of the government to get it into effect and completed. But I'm confident in the results of the studies. The vaccine is safe and effective. On behalf of Symphony leadership, I would like to thank our heroes for their hard work and their dedication. It's been a long haul, but there is now light at the end of this tunnel, and the vaccine is now available. We can now all do our part to put an end to this terrible pandemic.
On behalf of the healthcare workers, I encourage you to do 3 things: to educate, to vaccinate, and to communicate. 1, educate yourself about the vaccine. 2, get the vaccine. And 3, communicate to others on how important it is for us all to be vaccinated to stop this pandemic.
Thank you, Dr. Stemmer. We appreciate your leadership during these difficult times. When a person has cardiac arrest, survival depends on immediately receiving CPR from someone nearby. If performed right away, CPR can double or triple a victim's chance of survival. We'd like to share with you now a story that illustrates just how important knowing CPR is.
911, what is your emergency? I'm not ready that.
So that morning, I was awake at like 6:30, and Stephanie happened to be awake also, breastfeeding our youngest child. That was Lorraine. She was 6 weeks old. And after that, I remember dozing back off, and then Steph was still up breastfeeding the baby. And about 45 minutes later, about 7:20, I was awakened by her making some odd noises, like she was having a nightmare. I realized that she's gone. You know, I need to do something really quick. Right next to us, we had a 6-week-old baby in a bassinet, and her mom is right there next to her.
I'm in bed, really stiff, can't breathe.
Okay, she's having a seizure?
I don't know. She's purple, she's barely breathing. This is really scary. I'm not sure what's going on.
My name's Natalie. I was the 911 dispatcher that took Kurt's call. I knew Stephanie needed CPR when Kurt began to describe that she was changing color. He mentioned the color purple. Her skin was turning purple.
Do I need to do like CPR or something for this?
Is she breathing right now?
No, she's not.
Okay, I'm going to walk you through how to do CPR, okay?
Yep.
Okay, you're going to place both hands on her chest, right in between the nipple line, okay?
Yep.
Okay, you're going to press down hard and fast.
I did compressions for probably 4 minutes, and during that time, Stephanie would take a couple breaths, like the agonal breathing they call it. I didn't know what that was. I thought that I had her breathing again. I don't know. It's hard to. I don't know.
Come on, Steph. Come on, Steph. Annie, Delilah. Delilah, open the door for the 911. Hurry.
I am Stephanie. I am a cardiac arrest survivor, and I have long QT syndrome. Long QT syndrome is a genetic heart arrhythmia that can cause sudden cardiac arrest. 2 out of 4 of my daughters also have long QT. I would love to find a cure for long QT. It's a lot, just all of this. 18 months ago, this wasn't our life, you know? And now it is.
I would like just the word of arrhythmias and heart conditions that the percentage of survival rate is so slim. Stephanie was in a 1% chance survival for what happened to her. If it wasn't for the stars aligning, me being there, the paramedics only 5 miles away, just stars aligned, and thankful she's here.
Your investment to the American Heart Association can help change lives for future generations.
Hi everyone, thank you for joining us today to learn how to save a life with hands-only CPR. My name is Robert Wales, and I'm a paramedic and a CPR instructor with the American Heart Association. I'm here today to teach you how to perform hands-only CPR in recognition of CPR and AED Awareness Week. About how many cardiac arrests happen outside of a hospital each year in the United States? The correct answer to that is 350,000. That's almost 1,000 people per day that go into cardiac arrest here in the US. So now let's look a little bit more closely at where those cardiac arrests happen. So what percentage of cardiac arrests happen in the home? So when a cardiac arrest happens outside of the hospital, what percentage of those happen at home? That's going to be our next question. A is 25%, B is 40%, C is 55%, and D is 70%. Okay, correct. 70% of cardiac arrests outside of the hospital happen at home. We'll talk a little bit more about how significant that is in just a second. So some of us could go our whole lives without ever encountering an emergency situation. So most of us don't really think about it and we don't prepare for it. But that's okay, because that's why we're here today.
What a powerful story. Let's all learn the life-saving steps of the chain of survival now through community CPR from the American Heart Association and the University of Illinois Champaign-Urbana.
Hello everyone. So today I'm really excited to talk about hands-only CPR and this life-saving technique that everyone in the community can use to help save a life. So when do you use CPR? So CPR stands for cardiopulmonary resuscitation. And this is a technique that can be used for someone who's experiencing cardiac arrest. So first I'm going to talk about the 3 steps that are involved in performing hands-only CPR. So the first step is to make sure that you are in a safe environment. And again, I want to reiterate, the reason you would perform hands-only CPR is if you find an individual who is motionless and not breathing. Typically, we reserve hands-only CPR for adults and teenagers, and that is what the AHA recommends. So going back to the 3 steps. First, you want to make sure the scene is safe. Why do we want to do that? Well, if you are unable to provide care due to the unsafe environment, that can lead to 2 patients rather than 1. Once you have established that, you're going to want to ask someone to call 911. 911 will be able to guide you through this process too, and they are usually trained in CPR and also trained in training individuals in CPR. So if you forget any of the steps we talk about today, remember that 911 can help you through this. In addition to calling 911, you should appoint someone to go get an AED. The automated external defibrillator, or the AED, looks like this, And I'll get into more details about how to use that later. So step 2, I'm going to direct someone to call 911 and get an AED. If that is not an option, if you're the only person who's available in that room, you can call 911 yourself. The third step, and the most important step, is to start pushing hard and fast on the center of the chest, like so. So some things to keep in mind when you're pushing hard and fast on the center of the chest. You're going to want to place your hands in between the 2 nipples of your patient. And the other thing is you're going to want to make sure that you're going at a rate of 100 to 120 beats per minute. Now, not all of us are musical metronomes, so the best way of remembering what this is to think of the song Staying Alive by the Bee Gees. What we're doing is we're squeezing the heart to pump blood out. So we want to make sure we're actually pushing the chest enough to squeeze the heart. So we're going to want to aim for a depth of greater than 2 inches, or another way of thinking about it is 1/3 of the chest. So once we do those 3 things, that is how we've initiated hands-only CPR. So to review, we're going to be doing 1, making sure that the scene is safe. 2, we're going to want to call 911 and appoint someone to get an AED. And 3, push hard and fast on the center of the chest. Sir, are you okay? Are you okay? I see no response and I do not see the patient breathing. The scene is safe, so I'm going to direct Sean, call 911 and get me an AED. I have an AED. Can you put that on while I continue to do compressions?
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
All right, the pads are on.
Analyzing heart rhythm. Do not touch the patient.
Clear.
Shock advised. Charging. Stay clear of patient.
Clear.
Deliver shock now. Press the shock delivered.
Sean, I'm getting a bit tired. Can you take over compressions?
Yes, I can. CPR.
Now, obviously, there is this respiratory viral particle that's being transmitted. And especially if there's a person on the ground that you do not know, you have no idea what the condition is, and you don't want to ever risk your own safety. So the current recommendations for CPR on an individual that you're not familiar with involve hands-only CPR. What you can do is take a mask, throw it on your patient's mouth, and then you yourself wear a mask, which I'm going to take off for the purposes of explanation. And by allowing that, you can make sure that you're safe while delivering the care that the patient needs.
I was born into a lovely family, healthy and well.
She was never sitting still. She was always doing something, with something, running, moving.
She was very outgoing, very active individual.
At the age of 7, I went to the emergency room for stomach discomfort.
We thought maybe she had appendix or something, but they just said it was like a GI tract or something that was wrong. And they said, except for her heart murmur, she should be just fine. And we kind of looked at each other like, heart murmur? And so we decided to go to a physician, our family doctor, and have her looked at. He listened to her and he just said, I don't think it's anything to be super concerned about, but we actually want to be overprotective, so we're going to send you to Children's Hospital to let them, experts in that field, do it.
It was really amazing to me. The pediatric cardiologist was so well trained and so specialized. And I specifically recall the first time he put his stethoscope on my heart and the reaction that he had. He knew immediately that there was something wrong.
It was just within a matter of minutes, he just listened to her and he just said, well, she has a hole in her heart.
So an atrial septal defect, or an ASD, is essentially a hole in between the two upper chambers of the heart. The only option for me to live a long and healthy life was to have a surgical repair.
The unknown bothers everybody. And so when you don't know what's next, you worry a lot. But you have to take care of your kids.
That surgery was scheduled for within the month.
My mom gave her this doll to make things better in the hallway, to go down to surgery with her, and they dressed the doll in a gown.
So the physicians essentially worked on me and also worked on Baby Bubbles. So Baby Bubbles has her own wristband to match mine, and they also did put a surgical tape on her sternum as well, so we had matching incisions at some point.
The surgical process was about a 6-hour surgery, and it was tough.
When the surgery was over, the surgeon said he wanted to talk to us. And he said, well, everything went fine. However, the hole was twice the size. So instead of being quarter size, it was a $50 size, which was very big, which his concern was, how do you patch that? You know, do you just put a patch on and we have to repatch this? Does she have to go through this again? We don't want her to have to go through this again. And they said, no, we put a patch on that grows with your heart.
The internet wasn't a tool that you had available to you. It was basically books and knowledge that you could dig into to find out, or questions to ask.
And the only resource that they were given to help them understand was this book by the American Heart Association. So my ties to the American Heart Association date all the way back to this book, because I think this gave my parents the information and the understanding that they needed to feel comfortable.
Basically, the American Heart Association was trying to help us as best as they could at the time with a handout that they'd given us.
A year after my surgery, I was also diagnosed with what's called a bicuspid aortic valve. So a bicuspid aortic valve is essentially the valve of the aorta, or a really large vessel that shares blood with your entire body. And that aorta has 3 flaps on it naturally. And I was born with only 2 flaps. So essentially what that means is when my heart beats, the 3 flaps, because the 3rd one isn't present, my aorta doesn't close fully, so I have a deficiency in that valvular area. So we weren't really sure at what point that would need to be repaired, though it's very likely and still remains very likely that will have to happen. So in the meantime, there was no limitation. I can still go and do and be all of the things that I want to go and do and be. Unlike something external, I can't see what my heart is doing, and I think that's the scariest part for me. So obviously, as a congenital heart defect survivor and current patient, my heart is always on my mind, and it's always on the doctor's radars as well. So the big difference between myself and maybe those around me is that my heart never leaves my mind.
She's come a really long way.
Yeah, I hope whatever, when and if the time has to come that the replacement's there, I hope it's something very simple. I don't want her to have to go through anything rough.
Essentially, the American Heart Association, the research funded by the organization and the support that they offer patients, I know it's going to help me in my future. I'm aware that it's likely that I'll have to have another surgery at some point. And I just hope that by the time that is my body is ready for that the research will be such that that procedure can be as minimally invasive and as quick of a recovery as possible. Thankfully for that ER physician and speaking up when he did hear something abnormal, and thankfully for my parents who took the initiative to get further consultation from me, and thankfully for the physicians who took the time to evaluate me, I'm in a position where I'm here to share my story. I feel very blessed to be here today for all of the love and support that has brought me to this point. It is my mission to take the best care of my body and my heart so I can enjoy many more years with my family.
Thank you all so much for your generosity. With your help, we can make sure that every woman in Illinois has the chance to live a long and healthy life. And once again, thank you to our sponsors who made today possible. Our leading sponsors, Carl and Health Alliance, Christie Clinic, University of Illinois, Sarah BMW of Champaign, and our supporting sponsors, OSF Healthcare, Novo Nordisk, Busey Bank, Kirby Medical Center, Littlefields Group, and Martin Hood. And thank you so much to our donors who have made this year's Go Red for Women campaign such a success. Your generosity is saving lives. And thank you to all of you who joined us today. We look forward to seeing you hopefully in person next year. But until then, be safe, stay healthy, and love your heart.